Talk with Dr. Ernst Von Schwarz now, get an update on the pandemic and some other headlines in the medical world this morning. Dr. Von Schwarz, it's good to see you.
Good morning, Joey. Good to have me on. Thanks.
All right, so let's start with what we're learning about COVID today. There was some news coming out about the Moderna booster. The FDA said it didn't have enough, antibodies created for it to be worthy. What have you heard about this?
Well, the same thing. It's not FDA approved yet, even though Moderna, of course, tries to get the same approval as Pfizer got recently. But it's obviously there's not enough data yet, real-world data. We're talking about your real-world data versus clinical studies, which are always is just a limited number of patients. So, in general, I strongly believe that we will have approval for boosters for Moderna and Pfizer in the near future.
What else are you seeing? You work in a hospital every day when it comes to COVID. Are things improving? California has kind of been leading the charge here when it comes to the rate of vaccination and the rate of COVID infection. Very low here compared to other places.
Absolutely. Numbers really going significantly down, which is great. I personally have one patient left in one of the 6 hospitals I'm going to on a daily basis with COVID, a young lady, 34 years of age, since 2 weeks on a ventilator in a really bad condition, unvaccinated, of course. But I haven't seen any new admissions in probably a week now, which is good, and that represents what's going on in the state. The numbers go down, and if you go out here in California, I mean, you feel like there was never a pandemic. I mean, people gather everywhere in large crowds, and obviously the situation is much, much improved.
And I've only got about 30 seconds, but I want to get your thoughts on the news about aspirin and people above 60 being advised maybe that's not necessary anymore for the daily aspirin.
Well, aspirin was always advised for people with what we call coronary risk factors or atherosclerotic risk factors such as diabetes, hypertension, or family history more than 2 risk factors to avoid heart attacks. And that's questioned now because of possible side effects, in particular side effects of GI bleeding, internal bleeding in the stomach. So right now, it is advised to be a little more restrictive. That does not apply to people who had already heart attacks or strokes. They still should be staying on aspirin.
Dr. Ernst Von Schwarz, good to see you again. Thanks for joining us.